Hello everyone, welcome to OncoNerd, where complex cancer therapies are broken down into simpler bits of information. In this video, we will review one of the most common chemotherapy drugs used, Doxorubicin, also known as the Red Devil. By the end of the presentation, you will have learned about these key points about Doxorubicin. What is Doxorubicin? Characteristic of its bright ruby red color, it is also named the Red Devil. It is also known by its brand proprietary drug name, Adriamycin. It is a very commonly used chemotherapy drug found in various chemo regimens such as AC for breast cancer and RCHOP or ABVD for heme cancers. In the 60s, scientists were looking into soil microorganisms for new antibiotics. One strain, known as Streptomyces pusetius, as seen in the right upper hand corner, was known to produce a chemical that killed not only bacteria, but also cancer cells in mice. This chemical is now known as Doxorubicin, which is a cousin drug of Doxorubicin. Since its discovery, scientists have mutated the Streptomyces strain that was able to produce Doxorubicin. Doxorubicin has gained FDA approval in 1974. So how does Doxorubicin work? It is known as an anthracycline, which is known to insert itself into DNA and cause DNA disruption inside of the cell. It also blocks DNA repair enzyme known as topoisomerase II. And thirdly, it's known to generate reactive oxygen species that cause direct damage to cells. It primarily undergoes liver metabolism. Doxorubicin may be given as an IV slow bolus or as an IV infusion. It can also be given as a bladder instillation for bladder cancer. There is a cumulative lifetime dosing for Doxorubicin, as with all anthracyclines, due to the risk of cardiotoxicity. Doxorubicin should be adjusted for bilirubin, as well as platelets and neutrophils, as per its monograph. Some common side effects of Doxorubicin include hair thinning, nausea, vomiting, and low blood counts. It may also cause sores in the mouth. As mentioned before, it can cause cardiotoxicity, which is why cardiac monitoring is crucial for anyone on this treatment. Because of its red color, it is also known to cause urine discoloration, where for the first couple days after treatment, urine may turn red. It is a vesicant, and it can have extravasation potential. Doxorubicin is contraindicated in anyone who has severe liver impairment, as it relies heavily on the liver to metabolize. Because of its cardiotoxic effects, anyone with severe cardiac conditions may also not be suitable for this treatment. There needs to be caution when giving Doxorubicin with other cardiotoxic medications such as trastuzumab and certain calcium channel blockers. It is also a known CYP2D6, CYP3A4, and PGP substrate, so checking drug interactions is imperative. In summary, Doxorubicin, also known as the Red Devil, is a chemotherapy sourced from bacteria. It is a drug in the class of anthracyclines that may cause damage to the cellular DNA and cause killing. It is primarily metabolized in the liver. It is a chemo drug that can have notable side effects such as cardiac toxicity, hair thinning, and nausea, vomiting. And that's the end of this video. Thank you so much for tuning in. Please give this video a like and subscribe. Feel free to comment below for any oncology drug topics you'd like to see being covered in this channel. Hope you have a wonderful day.